Okay, now let's talk about acute interstitial nephritis, also called tubulo-interstitial nephritis. So when you look at the name, you might think, okay, that's so this it's an allergic reaction. Interstitial allergic reaction. Let's read first, and then I'm gonna tell you more about it. It's a tubules are affected. Interstitium is affected. Nephritis, inflammation of the kidney. So tubules are affected, and interstitium. What is interstitium? Interstitium is the connective tissue that is between the tubules. So tubules are, let me just draw some tubules here, the PCT and all that. So they are joined with each other with the connective tissue, that is the interstitium. So you have the tubular inflammation as well as the interstitial inflammation. Okay, now let's read. Acute interstitial renal inflammation. You have pyuria, classically eosinophils, very important, eosinophils, and azotemia. Okay. Occurring after the administration of drugs that act as haptens, inducing hypersensitivity. Okay, for example, diuretics, NSAIDs, penicillins, PPIs, rifampin, quinolones, sulfonamides, less commonly secondary to other processes such as systemic infections, mycoplasma, or autoimmune diseases like Sjogren's syndrome, SLE, or sarcoidosis. So you have all of them, autoimmune diseases and the allergic hypersensitivity reactions, right? It is associated with, and now it's fever, rash, pyuria, hematuria, severe tetanus, but can be asymptomatic. Remember the 5 P's. P for diuretics, pain for NSAIDs, penicillin and cephalosporins, PPIs, rifampin, sulfa drugs. So these are all the drugs that cause acute interstitial nephritis. Now, most important thing here is the fact that you have eosinophils and the rash, and urinary eosinophils can only be seen in only a couple of diseases. One thing is this. Second thing is the transplant rejection. Third thing is the prostatitis. Okay. So you have eosinophils in the urine. You have a rash, and you have the pyuria, and that's the acute interstitial nephritis. And now it is an allergic reaction. So you give these drugs. These act as haptens. They induce hypersensitivity reaction. Which allergic reaction or hypersensitivity reaction we are talking about? Type 1 hypersensitivity, which is mediated by IgE, and type 4 cell-mediated hypersensitivity reaction that causes the acute interstitial nephritis. So yeah, that's one more important thing is you will have how can you check eosinophils in urine? That is the Wright and Hansel stain, which is really important for this to diagnose this, right? So right enhanced stain detects eosinophils in urine. That's so in this disease you need to figure out if there are eosinophils there or not. Okay. And now this acute interstitial nephritis can progress to, again, going into renal papillary necrosis, or if you were to sedate, cessation of drugs can resolve the issue, can resolve the tubulo-interstitial inflammation. Okay, so that's pretty much all we have for the acute interstitial nephritis.